Traumatic brain injury, or TBI, is a serious public health concern that affects millions of people around the world each year. It is a complex injury with a wide range of potential long-term consequences. Understanding TBI is crucial for improving prevention, diagnosis, treatment, and support for individuals living with its effects. Imagine the human brain as a delicate, intricate network of neurons, blood vessels, and tissues, all working in unison to control our thoughts, movements, senses, and emotions. Now picture a sudden external force disrupting this delicate balance, causing bruising, tearing, or bleeding within the brain. This is the essence of a traumatic brain injury, a disruption in normal brain function caused by a bump, blow, jolt to the head, or a penetrating head injury. TBIs are not merely medical events. They are life-altering experiences that can impact every aspect of a person's life, from their ability to work and learn to their relationships and overall well-being. The effects of TBI can vary widely depending on the severity of the injury, the location of the damage in the brain, and the individual's overall health and pre-existing conditions. In the following sections, we will delve deeper into the complexities of TBI, exploring its causes, symptoms, diagnosis, treatment, and long-term consequences. We will also examine the critical role of rehabilitation, the challenges faced by specific populations like veterans and athletes, and the importance of a comprehensive public health approach to address this pressing issue. Welcome to CHS100, Optimizing Health and Performance. Traumatic brain injury is a major public health problem affecting millions worldwide each year. In the United States, an estimated 2.8 million TBI-related emergency visits, hospitalizations, and deaths occur annually. Falls are the leading cause, accounting for nearly half of all TBI-related visits. Other causes include being struck by objects, motor vehicle crashes, assaults, and sports injuries. TBI can happen to anyone, but certain groups are at higher risk, including young children, older adults, males, and those with a history of TBI. To truly grasp the complexity of TBI, we need to journey inside the skull and understand what happens to the brain during an injury. The brain, despite its remarkable capabilities, is highly vulnerable to external forces. When a sudden blow or jolt to the head occurs, the brain can be thrown against the inside of the skull, causing bruising, tearing, or bleeding. There are two primary mechanisms of TBI: penetrating and closed head injuries. Penetrating injuries occur when an object, such as a bullet or sharp instrument, pierces the skull and enters the brain tissue. This direct intrusion can cause localized damage along the object's path, potentially affecting specific brain regions and their associated functions. Closed head injuries, on the other hand, are more common and occur when the head experiences a sudden impact, but the skull remains intact. Although the skull provides crucial protection, the force of the impact can still cause the brain to move violently within the skull. This rapid movement can lead to a cascade of events, including a concussion. Considered a mild form of TBI, concussions result from a temporary disruption of brain function, often without visible structural damage. Symptoms can include headache, dizziness, confusion, and memory problems. Contusion. Similar to a bruise on other parts of the body, a contusion is a bruise on the brain tissue, often accompanied by swelling and bleeding. Depending on the location and severity, contusions can cause a range of neurological deficits. Diffuse axonal injury, or DAI, often occurring in high-speed accidents. DAI involves the stretching and tearing of nerve fibers, or axons, throughout the brain. These widespread injuries can disrupt communication pathways, leading to severe disabilities. Hematomas, life-threatening complications. Hematomas are collections of blood that form within the skull, putting pressure on the brain and potentially causing irreversible damage. Subdural hematomas occur between the brain and the dura mater, the outermost layer of the brain covering, while epidural hematomas form between the dura mater and the skull. Section 4. Recognizing the signs, symptoms, and diagnosis of TBI. Identifying a potential traumatic brain injury is crucial for prompt medical attention and appropriate management. However, recognizing the signs can be challenging, as symptoms can be subtle, delayed, or easily mistaken for other conditions. The presentation of TBI can vary significantly depending on the severity and location of the injury, ranging from mild, transient symptoms to severe, life-altering deficits. Common symptoms of TBI include physical headache, dizziness, nausea, vomiting, fatigue, blurred vision, sensitivity to light or noise, sleep disturbances, loss of consciousness, whether brief or prolonged. Cognitive confusion, difficulty concentrating, memory problems, slowed thinking, difficulty finding words, feeling mentally foggy. Emotional or behavioral irritability, mood swings, anxiety, depression, agitation, increased aggression, impulsivity, and personality changes. Sensory changes in taste or smell, ringing in the ears, tinnitus, loss of balance or coordination, numbness or tingling in the extremities. Diagnosing TBI involves a comprehensive evaluation to assess the individual's symptoms, medical history, and the circumstances surrounding the injury. Doctors typically use a combination of methods, including neurological exam, assessing mental status, coordination, reflexes, vision, hearing, and sensation. Imaging tests, CT scans, and MRI scans can reveal structural damage such as skull fractures, bleeding, swelling, or contusions. Cognitive tests, evaluating memory, attention, language skills, and problem-solving abilities to assess cognitive function. Prompt and accurate diagnosis is essential to guide treatment decisions and improve outcomes for individuals with TBI. Section 5. First line of defense, acute treatment and management of TBI. Following a TBI, immediate medical attention is crucial to stabilize the individual's condition, minimize further brain damage, and optimize the chances of recovery. The acute treatment of TBI focuses on addressing life-threatening issues, managing symptoms, and preventing complications. Emergency care includes airway management, ensuring a clear airway to maintain adequate breathing and oxygen supply to the brain. Circulatory support, monitoring and stabilizing blood pressure to ensure adequate blood flow to the brain and other vital organs. Neurological assessment, regularly assessing neurological status to detect any signs of deterioration or increased pressure within the skull. Medications may involve diuretics to reduce brain swelling, also known as edema, anticonvulsants to prevent seizures which can occur after a TBI, pain relievers to manage headache and other types of pain, sedatives to reduce agitation and promote rest. In severe cases, surgery may be necessary to remove hematomas, to relieve pressure on the brain, repair skull fractures, to stabilize the skull and prevent infection. Place a shunt to drain excess cerebrospinal fluid and reduce pressure within the skull. Section 6. The long road ahead, long-term consequences and rehabilitation of TBI. The journey after a TBI can be long and challenging, marked by a complex interplay of physical, cognitive, emotional, and social adjustments. While some individuals experience a relatively full recovery, others live with persistent or evolving challenges that require ongoing support and rehabilitation. Long-term consequences of TBI can vary widely depending on the severity and location of the injury, pre-existing health conditions, and individual resilience factors. Common long-term consequences include physical chronic headaches, seizures, fatigue, sleep disorders, balance and coordination problems, spasticity, paralysis, and sensory impairments in vision, hearing, taste, or smell. Cognitive memory problems, difficulty concentrating, slowed thinking, impaired judgment, difficulty learning new information, and difficulty with executive functions like planning, organizing, and problem solving. Emotional or behavioral depression, anxiety, post-traumatic stress disorder, irritability, mood swings, impulsivity, difficulty controlling anger, and social withdrawal. Communication aphasia, which is difficulty with language, dysarthria, which is difficulty speaking clearly, and cognitive communication impairments such as difficulty with social communication, understanding nonverbal cues, and following conversations. Rehabilitation plays a crucial role in maximizing recovery, promoting independence, and improving quality of life for individuals with TBI. It is a comprehensive, individualized process that addresses the unique needs and goals of each person. Rehabilitation may involve a team of healthcare professionals, including a physiatrist, a doctor specializing in physical medicine and rehabilitation, a neurologist, a doctor specializing in brain and nervous system disorders, a physical therapist to improve strength, coordination, balance, and mobility, an occupational therapist to enhance daily living skills such as dressing, bathing, cooking, and driving, a speech-language pathologist to address communication difficulties including speaking, understanding language, reading, writing, and social communication, a neuropsychologist to assess and treat cognitive impairments such as memory, attention, and problem solving. The goal of rehabilitation is to help individuals regain lost function, develop compensatory strategies, adapt to their limitations, and achieve their highest level of independence and participation in meaningful activities.